Okay, it's noon, so I'm going to get started. Welcome, everyone. My name is Catherine Van Tassell, and I'm the Director of Mental Health Consulting here at GBS. And this is the last of our 4-week series for September, which is Suicide Awareness Month. So this is your fourth and final presentation. I hope that you found this very valuable. And if this is your first time in our series this month, then we will be sending out recordings for the previous one. So it's okay, you didn't miss it. You still have an opportunity to watch them. So we'll just dive right in. So throughout this presentation, I know that you've been given lots of statistics on suicide prevention and what the temperature is out there in terms of what we're seeing. But I just wanted to do maybe a little bit of a reminder and cover a few things that maybe haven't been covered. Just to know the seriousness of this, because unfortunately we're seeing people becoming victims of suicide at increasing rates. So in the United States, roughly 50,000 people die by suicide each year. We see that the majority of this is working age adults. So such an important topic to cover in the workplace. And then according to SAMHSA, 1 in 5 adult Americans lives with a mental health condition each year. And we know that those that have a mental health condition can be at an elevated risk for suicide. We also know that those who misuse substances are an elevated risk for suicide. And sadly, only 1 in 11 people that misuse substances receive treatment. So only 40% of adults aged 18 and older sought treatment for their suicidal thoughts. And more than half of people who died by suicide, they did not know that they had a mental health condition. So a lot of times people are not seeking treatment or don't have access or means to treatment. So this is why we're talking about it. We're destigmatizing, making sure that we're educating on warning signs so that loved ones and coworkers can address someone that they may have some concerns about. And when we look at the workplace, there are factors to be considered here. So this can be bullying, discrimination, relationships, physical health issues, financial, legal, or housing stress. So in terms of workplace factors that have had adverse mental health factors, we see low job security, low pay, and job stress. Work organization factors such as long work hours and shift work. I just wanted to point out maybe for shift work, why would that be? And this likely is multifactorial, but we know that when somebody does shift work, their circadian rhythm gets disrupted. That can lend to increased physical conditions. We see rates of diabetes increase or worsen, heart disease, and then it negatively impacting mental health. Workplace bullying, and then having access to lethal means. And there are certain occupations that have also been found to have higher rates than others. So we see this in construction workers, law enforcement officers, veterinarians, and then some healthcare workers like dentists. So I won't read through this whole list, but just considering that and then knowing if you see somebody exhibiting certain symptoms that we're going to talk about that would be worrisome, and then you couple that with workplace factors, it's not one thing that we worry about. It's thinking about the collective of symptoms and risk factors that we would think, hey, we need to have a conversation. Because some people can have a mood change from day to day, and that doesn't necessarily mean they're unsafe. But what if they're in a high risk job? They have access to lethal means, they've had a change in mood, sleep, how much they're eating, or too much or too little, some things that we see are warning signs, and then they have low job control and poor support. We're just seeing that, hey, this person's at high risk. We need to have a chat with them or talk with HR. make some moves in getting them help. So from this list, conflicts, discrimination, harassment, violence, basically an unsafe psychosocial environment. So what can we do about this? I always like to look at the glass half full and knowing the warning signs, knowing the risk factors, but then how can we change? How can we destigmatize in our workplace and make it a safe psychosocial environment? Because we spend 40 hours at least at work a week, maybe 50, maybe 60, depending on your business. This is a great opportunity to make change. And we spend a lot of time with coworkers who notice our day-to-day behaviors and also likely see our stress loads. So we can see the signals and make some change. So here are 9 practices that we think about when we look at suicide prevention, mental health promotion, and worker well-being. And I wish that we had a lot of time to go through each and every one of these. But this is a start, and this is something that you could take as a template on maybe a 12-month plan. I would tackle one of these throughout the year. So let's talk about leadership for a minute. I always think of when we're doing a mental health strategy, when I'm working with a group, of starting at the top down, because the messaging from leadership really is important, and also the example. So if you have leadership, and I mean C-suite, and also all our people leaders that are managing one person or 50 people, there is a lot of power. And we see that statistically, where employees, if they feel like their people leader is a safe person to talk to, they're more likely to reach out and ask for help. This means that they're going to get treatment and decrease the chance that we are going to run into a crisis. But how do we do that? Because a lot of leadership has not been trained as a clinician. They're not social workers or physicians or LMFTs. So how can we do that? And there are many different options. One is, well, let's train the trainer. So doing things like mental health first aid, QPR, which is a suicide prevention, vital cog, also suicide prevention in the workplace, giving leadership the opportunity to take these trainings, which equip with them with the knowledge to recognize mental illness. So everything from depression, generalized anxiety, suicide ideation, substance misuse, and then how do I speak to it? So it's one thing to recognize it, but then it can be very anxiety provoking for somebody to talk to a coworker about this. And I think historically, this was something we didn't talk about as much in the workplace. So that can feel like an uneven ground to step on in the workplace. But again, it's okay to talk to people and ask how they're doing. So recognizing, knowing how to speak or to address somebody, and then not feeling like we have to take this on and that that leader has to be the person that treats it, having appropriate resources at their fingertips. Then job strain reduction, really considering what is it like to work in my workplace? What is it like to work as a leader if you are a leader? And do we see too much load and not enough time for somebody to have a clear expectation of what is given to them? Or toxic work environment? How are we communicating? Self-care. So this is a great little place to pause, thinking about what are our opportunities to have care for ourselves in the workplace. And there are all sorts of creative things that I'm seeing groups do. One is to have a meditation room. So this is a place where somebody could feel like I'm a little overloaded, I'm overstimulated, I feel like I have more things than I have time to do, and my brain is starting to go offline. So I'm rereading the same thing over and over again because my frontal lobe is being overwhelmed with the stress level. I have elevated cortisol, and that's taking my brain offline. Um, okay, I can go and take 5 or 10 minutes to do some breath work in a quiet place. What does that mean? Well, when we breathe for just 5 minutes, or if we even have 10, our heart rate goes down. Stress hormones like cortisol, norepinephrine, epinephrine, those go down as well. We come out of that fight and flight where our brain comes back online. So our mentation is improved, our focus is improved. What if sitting in a quiet space is not an option or not, maybe that doesn't speak to somebody? Is there an area around your work where somebody can walk on a tree-lined street? You can still have cars going down it, but we know that when people walk down tree-lined streets, that their stress hormones come down. There was work done out of UC Irvine showing people that were in a stress state, just taking a 5-minute walk on a tree-lined street decreased their cortisol. These are free interventions that make physical changes that improve how our brain works. But we need to talk about it and give people space to do that. Okay. Training, I talked a little bit about this with mental health first aid, but we can train all employees. And even better yet, what about having wellness ambassadors or mental health champions? Training a group of people and creating a team for them at work. These are safe people to talk to when needed. Making sure that we provide mental health resources. So this can be EAPs, this could be something like Calm or Headspace. Insight Timer is a free mindfulness app promoting these within the workplace. And we've already talked a lot about mitigating risk. And then having a crisis response plan is always really important. And we've chatted about this in that previous screen, the mental health champions, leadership, education. So what are some signs that I should look out for? You have seen this in previous presentations if you've been here, but for completeness sake, changes in mood, feelings of worthlessness, feelings of wanting to die or end their life. We see isolation, loneliness, hopelessness, decreased self-esteem, withdrawing from things that we love to do, friends, family, colleagues, social commitments, restlessness, irritability, impulsivity, being reckless. I talked about misuse of substances. Speaking about, gosh, this is just really too hard. I feel like I'm a burden. It would be easier if I wasn't here. And then, of course, we saw bullying, harassment. So, like I said, it's important to talk to people and not be afraid. It's okay to ask somebody, are you thinking of hurting yourself? Have you had thoughts of suicide? Do you have a plan? So don't wait. You're just there to listen and provide a safe, judgment-free environment for somebody to talk to you. And doing that in an environment free of computers and phones so somebody isn't worried that you don't have enough time to chat with them. And this is what I was talking about, some of the things that you could say to them. I care about you and I want you to get the help you need. I know of professionals that help with this. I know this can be very hard to talk to, and I'm so happy that you're opening up to me. I'm a confidential space for you to talk to. I'm glad you told me. I care about you. So again, just listening, validating, and providing a safe space for people. And then always reach out to HR. There are certain policies in your workplace that may assist with this. They may be able to help somebody take some time off, FMLA or short-term disability, and give them resources to care for themselves. So don't feel like you have to take this all on. And when you're talking to somebody and you may need to go share something with HR, just share the most pertinent information. They likely don't need to know every detail. So we're helping that person maintain their privacy as much as possible. And thinking about leadership, making sure that staff know what resources are available, fostering this environment I've already talked about, really strengthening connections and relationships in the workplace, normalizing mental health, normalizing speak around mental health language and getting help. This is not a sign of weakness. It really is a sign of strength. We're caring for ourselves, we're doing our work, and having a plan in place in your workplace for crisis management as well. And you can reach out to the wellness team or myself to help you with that if you don't have one in place. Okay, with our last minute or two together, I just wanted to give you a couple of things to look at. So this is a web page called Live Through This. And this photographer, writer, and now she's a suicide prevention advocate, has taken pictures and stories of hundreds of people, and they're on her website. And the thing that I think of when I look at this picture is these are different sexes, different backgrounds, different races, different ages. And every single person here and on her website has either survived a suicide attempt, has had thoughts, but they're doing their work and they are thriving for now. That doesn't mean we all have these ups and downs, but they're doing well. And so looking at this, sharing this with somebody who may feel hopeless or I'm the only one. No, this impacts so many people. And again, it doesn't matter where you come from, your race, your age, your background. This is impacting all of us. So remember our resources that we have: the National Alliance on Mental Health, American Foundation for Suicide Prevention. I live in Utah, so there's a few that I always like to call out. You can visit your local government mental health authority. So here it's utah.gov for me. And then we have 211 if you are in Utah, which I know a lot of our groups are. This is a great resource page for help with finances, shelters, domestic violence, lawyers, utilities. It's just a nice resource to have. And then just lastly, liveonutah.org. This has on their webpage, and then they have an Instagram. You can go through 10 modules. It takes about an hour, and they provide suicide education. It's a suicide prevention program. And if you go through all of those modules, you become a Live On ambassador as well. You don't have to live in Utah to do that. And if 80% of your workforce does it, your workforce, your workplace becomes a Live On ambassador as well. Also, a wealth of resources on there. 988, our National Suicide and Crisis Lifeline. Please feel free to reach out to this. You don't have to be in crisis to reach out and use this number. Okay, I went over a couple of minutes. So I'm thankful that you guys were to stay. I'm happy to stay on and answer any questions that you might have. And for those of you that need to go, thank you so much for your time. We have some people saying Headspace is a wonderful app, and I agree. Oh, and an office has a wellness room. We have people champion ambassadors. Oh, thanks for these comments. Headspace is great for kiddos too. They have Sesame Street and Star Wars. There's a lot of resources for families as well. You're welcome, everyone. Thank you. Oh, I'm glad you like the mini series. We like them too. It seems like people are really enjoying them. Oh, okay. So we had somebody ask about a child to check in if they've expressed suicide thoughts in the past. One of my top recommendations would be it would be important to get this kiddo in with a therapist. um, just so they could start to gain distress tolerance skills, interpersonal relationship skills, which are going to take them throughout their childhood, adolescence, and adult life. I always think if you can start building these skills now, what a gift that is to go into adulthood with. The other thing is if you start working with a therapist, you could do some family sessions. And during that family session, I would recommend putting together a safety plan. You can get a safety plan online with the therapist. They also have apps. In a safety plan, what you would do and what the therapist would do with that child, which would be very helpful because sometimes children, depending on the age, um, it's difficult for them to express their feelings because they may not even be able to identify how they feel. And so when you're working with that therapist, that can help identify triggers for thoughts of self-harm or just negative thoughts. Then teaching that child how to recognize them and then tools to deal with that. So that could be, I'm going to play really loud music and I'm going to dance in my room, or I'm going to go talk to an adult about it, or I'm going to, there's a number of things that you would come up with on that safety plan. This would also give you the opportunity as the parent or as an adult in this situation with that child, if you're an aunt, uncle, whatever that relationship is, for you then to have your role in what you're going to do. So that could be, hey, every Friday, we're going to go on a walk together and we're going to check in and we're going to talk specifically about the suicidal thoughts, how you're doing. So there's direct communication. But we have a plan for this. So it doesn't feel like out of left field, mom's coming at me to ask me about this and I wasn't ready or prepared. This just really sets us up for success and also a very safe plan for that child to come and talk to you in the future as well, because we've really set this up to be a therapeutic environment. Um, Check with your EAP if you have not utilized that resource to see a therapist, or go to psychologytoday.com, which is a very helpful page where you can filter through male, female, location, insurance, cost, type of therapy. So this would be with children, and that is a nice tool to use as well. And then I have a question on, you're very welcome. And feel free to reach out to me via email if you have some more questions. Do I have any suggestions or resources for specific demographics? Yes. So I would recommend looking at the National Foundation for Suicide Prevention, Live On Utah, and SAMHSA. I know Live On Utah, like you could see, and I can go back to this really quick. You could see that they have resources for different faiths, LGBTQ plus, youth, workplace. And then when you go to the National Foundation of Suicide Prevention, also information for specific demographics. You're welcome. And if you have a more specific question, my email's at the bottom. I'm happy to help guide you to a more specific answer. Oh, good. Okay. Well, again, my email's at the bottom. Thank you for coming and have a really nice day.